So you'll be learning about marijuana, the world's most used illegal drug. Millions of teens have tried pot. It is considered a gateway drug. What is a gateway drug? Do you agree that marijuana is a gateway drug? Marijuana is a plant that gets dried up. It's usually green, brown, or gray in color, and usually smoked, vaped, or sometimes eaten in the form of edibles. Most of the time we will hear marijuana called pot or weed, although it does have many other nicknames. It is considered a psychoactive drug, which is a mind-altering drug. What gets you high in the marijuana is the THC, the tetrahydrocannabinol, which is not in any other plants. Immediate physical effects include dizziness, increased heart rate, coughing, dry mouth, red eyes, sleepiness, munchies, meaning you get very hungry and want to eat constantly, dilated pupils as seen in the picture, and distorted sights and sounds, so you might hallucinate or think you hear things or see things that you do not, and loss of coordination. Immediate mental effects include short-term memory loss, distorted perception, more social paranoia, everything you think is funny, everything you hear, lack of sense of time or awareness, trouble thinking and problem solving. Another check for understanding. What is in pot that makes you high? Name 2 physical effects. Name 2 mental effects of smoking marijuana. Long-term effects on your body include, obviously, addiction. You absolutely can become addicted to marijuana, although a lot of teens will tell you that's not true. Cancer, short-term memory loss, coughing, more chest colds, emphysema. You can build a tolerance to it, meaning you might need to smoke 1 or 2 puffs right now to get high. In time, it might be 1 joint, and then a few months down the road, it might be 3 joints. Before you know it, you need pot all day long in order to get high. Temporary loss of fertility, or you could become sterile, and your sperm begins to swim in circles. The long-term effects on your life include you could have trouble maintaining a job or keeping up with your schoolwork, could lead to family problems or other relationship problems. You could become a burnout, which is probably a stereotype that you hear about students who smoke marijuana or teens. All you care about is getting high, and that's all that becomes important to you. Every day you wake up, how are you going to get high? How am I going to get high today? You give up on activities or hobbies that you once were really into. For example, let's say you were very into baseball or any other sport, or dance or musicals or an instrument. You slowly over time give up on that hobby or activity, and you're less likely to have a career. You might be able to hold down jobs, but a career that you could get promotions, move up the ladder on is less likely. Medical marijuana is used to treat people with cancer, AIDS, diabetes, arthritis, multiple sclerosis, chronic pain, and glaucoma in order to relieve pain, control nausea, and/or increase appetite. Many states have legalized it for these reasons. There is now a new trend. Back in about 2008, it was created. It's called synthetic weed. It's sometimes called Spice or K2, which is common street names. And it's a designer drug where herbs, incense, and other leafy materials are sprayed with a synthetic chemical that mimics the effects of THC. That is the drug that makes you high. That is the chemical that makes you high in marijuana that's found in marijuana plants. It gained popularity back in 2008 until 2012, which is when the DEA, which is the Drug Enforcement Agency, started to pick up on how horrible the synthetic marijuana was and made it illegal. So it's very strong. Sometimes it could have similar effects to marijuana, but sometimes greater effects. Users say they feel nauseous, they vomit, they're agitated. They sweat profusely. They have high blood pressure, anxiety. They hallucinate. They're very confused. Their speech slows down, catatonia, and seizures. Doctors say addiction and withdrawal are possible as well with K2. There are no concrete long-term effects of what K2 or spice can do to you because it has not been around for long enough for us to tell what will happen in the future. The DEA, which again is the Drug Enforcement Agency, declares K2 spice synthetic marijuana a level 1 drug, which means that it has a higher chance of addiction. You can't buy it, you can't sell it, you can't possess it, and usually it has very little medical value. These are all the ways in which you can ingest or smoke marijuana: through a pipe, a blunt, a bowl, THC oil through a sort of a vaping pen, and those are different vaping supplies down on the bottom, a joint, and a bong. Your final question will be a short response again. What do you think about New York State making it legal for people over 21 to buy marijuana for recreational use? Do you think it will add to the drug problem that America has?